Hi, I'm Dr Peter Macken, the developer of the Torix Disposable Marking and Alignment System. This is my technique for use. At a sterile workbench using sterile gloves, open the packet marked 1. Next, pick up the handle and attach the handle with a horizontal orientation so it is ready to mark the cornea of the patient. Using a sterile gentian violet pen, generously apply ink to the under ridges of the preoperative marker. All 3 ridges need to be coated with ink. I wear LED glasses to assist horizontal meridian determination. With the patient sitting up and fixating at a point between the 2 LED lights, I dry the precorneal tear film, usually with a stroll. I carefully align the marker with the horizontal meridian. I gently press the preoperative marker against the cornea of the patient. Preoperative marking is now done. At surgery, lightly ink the underside of a Drysdale spatula or similar with a new sterile gentian violet pen. Place the intraoperative alignment guide from the packet marked 2 on the patient's eye, aligning the circular guide with the reference points on the cornea. Then, with the inked Drysdale spatula or similar, mark the predetermined steep axis of the cornea. In this example, it is at 30 degrees and mark both points 180 degrees apart. Cataract surgery then proceeds in the normal fashion. After the toric IOL is implanted, it is then rotated to align with the steep axis marks as viscoelastic is carefully removed. More information on the Torix Disposable Marking and Alignment System is available